celebrated National Health Center Week. The three of us, we were assigned specific topics to talk about. But Mr. Austin, as usual, really stole my thunder. Okay. I'm going to provide you some statistics in addition to what Mr. Austin just said. And I'm going to quiz you at the end of my 5 minutes. I also want to thank City Department of Health, because the 3 community health centers, we've been partnering with other service organizations, and Matt, Karen, and others have been very, very supportive of what we do. So for the first time, this celebration has been going on for years, but for the first time, we included other service partners, because they also serving the uninsured, underinsured, and the indigent population that we all strive to help. So the community is coming together to provide services that are needed most by this client. So thank you, Karen and Matt, for joining us, especially Kathy for being part of the team. Community health centers, in Cleveland right now, we served, the total number of patients that we serve is 60,877, to be precise. This is very interesting because Care Alliance, among all the 3 federally qualified centers in the City of Health, our mission is truly to support people experiencing homelessness, people who are sleeping under the bridges, the gardens, the hard-to-reach places. So we target those people, we take healthcare to those places to make sure that they get the services they need. Now, because of the economic downturn, because of the economic situations, as Representative Kenny and Mike said it very well, the unemployment had really exacerbated the need for healthcare. Check these statistics out. The most recent unemployment, before we came over here, we were looking at Ohio Department of Job and Family Services. It showed a rise from 10.8 in May to 11.1 in June. That means that the U.S. average is about 9.5. That means that we're talking about 647,000 Ohioans lost their job. And simultaneously, most of them will lose their health insurance, because you have some entities that are providing services for them, and if they can't, they don't have a job, they don't have health insurance, so they come to our doorsteps to seek the care that they need. City of Cleveland alone, the rate of unemployment is about 12.2. That translates to about 23,000 people without jobs. I was coming here this morning watching CNN. There was a piece about a place in Ohio, I can't remember, that the unemployment rate had reached 13.2. And people were flooding into their free clinics to seek care. So there's a dire need out there, but we pledge our support to address these issues. That's when President Obama's administration released the ARRA dials, the FQACs banded together to get a piece of it so we could increase the services that we do. Relating it to Care Alliance specifically, when they first released, nationally though, President Obama's administration released about $2.5 billion to federally qualified health centers. Currently, we have about 1,200 nationally. So the $2.5 billion for this 1,200. But in phases, 500 of them was for National Health Service Corps for recruitment and retention of the providers, and 1.5 million was for services. They released the first $500 million. NIAN received a chunk of it. Neighborhood Family Practice received a chunk of it. And we did a Care Alliance. We got about 300,000. What did we do? Because the need for dental services. If you are providing services to the homeless population, before they come to your doorstep, you know they're really in need, because that's the least on their mind. If you're making sure that you go sleep under the tent, get covered, and not be rained on, healthcare is really the least. So by the time they show at our doorstep, they're really, really ill. So what we did is that we used all that money for dental services, to be able to hire dentists, dental assistants, to increase the number of patients that will come for dental services. Then in March, the federal government released additional $1.5 billion, and that was to help community health centers to renovate, repair, buy facilities, because most of the FQAC centers are really dilapidated, antiquated, so they needed to enhance it, bring it to the state of art, because people need a dignified place for care. If I'm going to my PCP and the place is not respectable, the place is falling apart, there's no way I would do that. Wherever you want to provide care, it's a place that you could send your mom, you could send your dad, or you could send your loved one. If you cannot do that, then it doesn't make sense to provide services there, because you're doing a disservice to the client that you serve. So we get a piece of the money, and we are all banding together to make sure that we march on electronic health record. so that we don't, when somebody shows up Care Alliance in the following week, I see the Department of Health or Neighborhood Family Practice, we do not duplicate the test that we just did last week. So we save the system some money. That's where I'm going to end my presentation at this point. Thank you all very much for coming, and I yield it to Jane Thierry.